If you're struggling with type 2 diabetes or know someone who may be, there's a new treatment. They may actually reverse the disease. And Dr. Drew Anthony joins us now. He's going to tell us more about it. Thanks so much for coming in.
Thanks for having me.
Why do you think so many people get so frustrated as far as type 2 diabetes? Because it really does, I know it does a lot of damage and it's really hard and there's a lot of medication.
Absolutely. Well, it usually starts off on a routine visit. They don't even know they're diabetic. They get some routine blood tests, comes back, their sugars are elevated. They're labeled type 2 diabetic, they're given one or more medications, and as the disease progresses, they're given more medications. They're told the same thing: lose weight, change your diet, and exercise. And a lot of them are scared because they're starting to have complications, neuropathies, vision problems, kidney problems. This patient was taking all this, and she was still having cholesterol issues, her vision started going, she was really scared.
Hold on here. This right here was from one patient?
One patient, 3 times a day. It took her an hour to get through this.
No way, why? This is so much,
Yeah.
It's crazy. So obviously you see this and you're like, you know what, we have to do something different. Most patients, they do not want to take all of this stuff. So tell me about your approach and what makes it different.
Well, what I found throughout my career is that every single diabetic has a different cause or driving mechanism to the disease. Not two people are ever the same. And my frustration is that everyone's treated exactly the same across the board, and they're getting terrible outcomes. So we find what's driving the disease and causing it, and we customize a treatment plan for that individual. That's where we see the disease reverse, meaning they regulate their blood sugars, they reduce, eliminate medications, they have more energy, they lose weight without exercise. But Destry, I make sure we test them throughout the process so there's irrefutable evidence they're absolutely reversing the disease, period.
Yeah, so you actually can reverse the disease.
It's amazing. I rarely see anybody fail. Like, this patient no longer has to take these. She brought a big box and says, I'm done. I'm not diabetic anymore.
Now, and we were talking about this and you were saying, I said, well, type 2 diabetes, doesn't it come on like when you're older in age and maybe you haven't taken care of yourself, but you said it can happen to a lot of people.
Yeah, there's professional athletes that are labeled type 2 diabetic, but they only go after the sugar. They don't go after what's driving it, and if you don't do that, the disease will progress.
Now, what do you look for in a patient that's maybe looking to get off all of these medications?
Really someone that's really motivated, that their hands are up, they're like, Coach, you tell me what to do, and I'll do it, because everyone's different. I don't know what they're going to have or need.
Okay, so once they come in, kind of take us through the process. They talk to you, you go over what they're taking, and then you go over a treatment plan.
Yeah, if it's a good fit, we'll work out a treatment plan. We'll see what's driving and causing their disease, and we customize our approach for them to see their disease reverse.
Okay, tell us about the opportunity for viewers right now.
Well, we're offering a free dinner and seminar so they can come in and see what our clinical model is and really make sure it's a good fit for somebody and make sure they're motivated. The seating's limited, so they need a call, and the number's on the screen, 480-544-4545.
Yeah, you can also go to innerhealth360.com to learn more, or again, call the number on your screen for that free diabetes dinner and seminar.